that set of announcements from the federal government, and obviously what we did at State Department of Health as well. And so we're welcome all of you to ask any further questions on that since yesterday. In addition to that, we are continuing to monitor what's happening with the phases across the state of Washington. As you know, that all counties were in phase 3. And then earlier this week on Monday, we announced that 3 counties will be going back to phase 2. And we can also discuss that in more detail if there are questions about that. But let me start with some positive news, and that's really about. And as you know, one of your colleagues called it affectionately not Tax Day but Vax Day, and we adopted that affectionately as well. That we have tomorrow the opening up of eligibility to all Washingtonians who are the ages of 16 and older. And that is a tremendously important milestone for us at the state of in our state in Washington. And the reason why it's such an important milestone is that throughout this process, as you know, for the last 4 months, we have been focusing on those who have been most vulnerable, those who we believe are at higher risk, those who, because of occupation, might be at risk, or seniors or elders above the age of 65, just with the concerns about protecting all of these individuals from COVID-19. And tomorrow, it now opens up to, again, above the 16 and older, opens up to everyone. And that is incredibly important because what it starts to show, and if I could have the team pull up our 3-legged stool slide, what it starts to show is that while we still have the constraints with vaccine supply, we know that one of the challenges that we are still struggling with is the ability to match supply, logistics, and demand. And when supply has been the limiting shortest leg of the stool, the challenge becomes trying to assure that that we are able to continue with our work in the logistics and administration, as well as pay attention to vaccine demand and vaccine confidence. So from tomorrow's opening up of eligibility, we no longer will have any artificiality to who is going to be eligible, who is not going to be eligible. And it's really at this point going to be making sure that we have vaccine access, that the logistics are strong, they're enhanced, they're appropriate, that we continue to message and communicate with the community about the importance of vaccines, the importance of that the vaccines are safe and they're effective, and that we want people not to hesitate to vaccinate. And finally, we are continuing to get news from our federal partners about vaccine supply, which I know Michelle Roberts is going to be speaking about what the vaccine road ahead is like. Earlier this week, we hit the milestone of, it was over the weekend, of administering over 4 million doses. We're now at 4.2 million doses of vaccine given. And as you know, that's almost 35% of our population that's had at least one dose. The administration, we've administered more than 82% of the roughly 5 million doses that have been delivered to our providers and long-term care programs, et cetera. And the reason why that's so critical is that way back, if you remember the first part of January, we were really in the just under 30% of administering the vaccines that were coming into the state of Washington. So while the supply has been increasing, we still have supply demand, the supply constraints. We are really making sure that every vaccine dose that we have is being administered. And we want to make sure that that's not just being done from a number standpoint, but also from an equity standpoint. And we are looking at our vaccine goals, the overall goals. If you remember, it was 45,000 vaccines a day that we were administering, and we're looking at revamping that for a new goal and also to add equity goals alongside with that. Equity remains a focus for our prioritization, for our allocation, including at our state vaccination sites, and that's going to continue. We've listened to feedback, we've solicited feedback from our community members, and particularly those from BIPOC communities and those that are most impacted or have been most impacted by COVID-19. And what we know is that equitable access remains a key driver for both vaccine logistics and administration, but the third leg of the stool with vaccine demand and vaccine confidence. So I want to highlight a couple of quick things, which I think is also critical. And as you see on the slide that's ahead here, whoops, I think I'm still seeing the three-legged stool. Is that still me? All right. Give me one sec here to, I clicked on the wrong button here. Is that all 4 of our Department of Health supported mass vac sites are now going to be open effective Monday of this week, at least 2 evenings a week until 8 p.m. Our FEMA supported Yakima mass vac site is now open 7 days a week until 7 p.m. And starting April 25th will be extended all 7 days to 8 p.m. So we know that it's not just about vaccine hesitancy, it's also about vaccine access. And when many of our team members met with Governor Inslee and we visited the Yakima site last week, what we really learned was that the hours were a potential barrier for many in our community. And we want to not just encourage that happening at the mass vac sites that the state of Washington is operating, but we want to make sure to encourage that of our vaccine operators, those who are operating clinics throughout the state of Washington, so that they are providing access on weekends, they're providing access into the evening hours. And one example of that will be when Dr. Wando Anyoku is the Chief Health Equity Officer for Swedish Health Service is going to be talking about mobile clinics and the incredible equity work that's been being engaged in by their system. And I do want to thank her for joining us today, but I also want to say that she's just one example of so many fantastic examples that are happening across the state of Washington. I also want to talk about some of our numbers. We are continuing to, as you know, race against the clock when it comes to vaccines. And we are very concerned about the fact that we are seeing increasing trends in cases in the majority of counties across the state of Washington. We've seen sharp increases, as I mentioned, all over the last 2 briefings, along with Dr. Lindquist, amongst younger age groups, especially those in the teens to their 40s and 50s. Hospital admission rates are increasing in most age groups, and that is of concern to us, and that particularly is of concern in the younger age group, those groups that aren't vaccinated yet. We are concerned that we're starting to see potentially the beginning of a 4th wave. It's hard to know, but we really recognize the fact that whatever progress we had made from the 3rd wave appears to have plateaued, and now we're moving in a direction that is concerning to all of us. So we need to take it seriously. Some of our trends, like transmission, look very similar to where we were at the start of November as the 3rd wave began. Most people in our state are still vulnerable to this horrific disease. As you know, although we've made progress and 1 in 5 Washingtonians are vaccinated, still 78% are not fully vaccinated yet. So there is a lot that we need to do. And while we're also working towards vaccinating as many Washingtonians as possible, we're also watching what's happening with variants across the state, as well as our vaccine breakthroughs. And what I want to report today, we'll have a report that's going to come out over the next couple of days on this, is that 217 vaccine breakthrough cases have occurred in the state of Washington as of April 3rd. That's up from our initial announcement on March 20th of 102 cases. And we know that vaccine breakthroughs have now occurred in 24 of our 39 counties. Now, this is expected with any vaccine that's not 100% effective. And as you know, although these vaccines are incredibly effective, they are not 100% effective. But I want to then keep in context that less than 0.01% of the more than 1.7 million fully vaccinated people in the state of Washington are represented by these 217 breakthrough cases that I just reported. So I think it's absolutely critical that we continue to vaccinate as quickly and as many people as possible. And we also are watching variants, and Dr. Lindquist can speak to this as well. Again, the predominance has been in the California variants, in the B427, B429. I'm sorry, 427, 429 in across the state of Washington. We're not seeing the B117 in the numbers that have been elsewhere, but obviously we're watching that as well. So we know that vaccines are safe, they're effective, they're already working to protect our communities. We know that increases younger age groups, partially are protecting those who those who are older and those who are not vaccinated, but we also know those who are older and those who are vaccinated have been protected from even those that are around them. Patience is needed as we continue to open eligibility up. When available, vaccine offered to you, we want our community members to know, don't hesitate, vaccinate. That's the same message to our providers, don't hesitate, vaccinate. And getting vaccinated again means returning to some life where you can hug your loved ones, you can protect yourself, protect your loved ones, protect your community, and certainly taking a critical step to get back to some level of normalcy, which has been very difficult for all of us during this pandemic. I want to thank all of you for everything that you continue to do in the midst of the challenging times. As you know, the message from yesterday with the Johnson & Johnson vaccine, and Michelle Roberts is going to speak to this. Again, it shows that our vaccine system is working. It also shows that we are going to have twists and turns throughout this process, and we have to be ready for those. I've said this a few times, and I will say it again until I stop saying it, because we're out of the pandemic, which is we are in this pandemic until the pandemic is over. And this pandemic is not over yet by any stretch of the imagination. If you see what's happening across the country or across the globe, there is no reason that Washington is somehow immune from increases that can occur. Finally, let me just close by saying, please help us in continuing to take the preventive measures. Make sure you wash your hands, wear your mask, watch your distance. If necessary, if you've been exposed and or have symptoms, you get tested, and certainly don't hesitate, vaccinate. So the 3 W's, the T and the V, get us to where we are really as a state in terms of moving forward. It's a delicate time for all of us because we know the wave is starting to come back, and we don't want that to happen. There's still time for us to protect ourselves and our loved ones and our communities. We're doing everything we can from a vaccine standpoint, from both a quantity and an equity standpoint, but it's absolutely critical that we work together with all those other preventive measures as well. So I want to thank all of you, and I'm going to turn it over back to Frangie. And I will say that Dr. Lindquist and Lacey and Dan are available for additional questions as well, although Michelle and Dr. Onyoku are going to be the 2 prime speakers. If there are questions about either the rollback, if there are questions about where the vaccine numbers are, as well as the trend numbers in terms of where we are, Michelle and Dr. Lindquist can answer those, and then certainly Dan from a standpoint of our public-private partnership. So thank you with that, and Frangie, turn it back to you.
Thank you, Secretary Shaw. Next, we'll go to Assistant Secretary Michelle Roberts.
Good morning, everybody, and thank you, Secretary Shaw. I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the Department of Health. I think we can all agree it's been a busy week, and it's not slowing down. I want to start by celebrating some of our vaccine accomplishments. Dr. Shaw highlighted that we recently hit another milestone, administering 4 million doses of COVID-19 vaccine in Washington. We're vaccinating more than 57,000 people on average every single day. And our 4 state-led mass vaccination sites continue to do great work. Since opening January 26, they've given out more than 200,000 doses of COVID-19 vaccine. And in fact, I heard that yesterday at our Clark County mass vaccination site, we gave out over 2,000 doses of vaccine in one day, including a final 800 of those doses happening in the later hours with the expansion to 8 p.m. So really thrilled to see that progress and to help make it easy for people to be vaccinated. As Dr. Shah mentioned, out of an abundance of caution, yesterday we decided to follow the FDA and CDC guidance and pause the use of the Johnson & Johnson vaccine in our state. Safety is our top priority, and this shows vaccine safety monitoring systems are working. The safety monitoring systems were able to pick up a very rare event, 6 people nationwide out of almost 7 million. And those 6 people experienced a rare but serious potential side effect after getting the J&J vaccine, including blood clots combined with low platelet counts. I say potential side effect. We know these things happened after getting the vaccine, so they're associated with the vaccine, but we do not know yet if they're caused by the vaccine. This pause allows for further investigation and for further provider education to be aware of the possibility of this event so they're on the lookout for it, and to make sure healthcare providers know what the treatment options are. Nearly 7 million people of J&J have been given, doses of the J&J vaccine have been given out across the country, which means that a very small fraction of people experience these potential side effects. Here in Washington, about 169,000 doses of Johnson & Johnson vaccine have been administered, and we are not aware of these side effects happening in our state. That 169,000 doses of J&J vaccine is through Monday night, April 12th. So it's a little bit higher of a number than we shared yesterday, and that's because more doses were continuing to come in, be reported to the state through that Monday administration. If you got the J&J vaccine more than a month ago, the risk is very low. If you got the J&J vaccine within the last few weeks and get a bad headache, stomach or leg pain, or shortness of breath, please reach out to your healthcare provider. It will be important that you let your healthcare provider know that you've had the J&J vaccine in the last few weeks. The CDC's Advisory Committee on Immunization Practices, or ACIP, is holding an emergency meeting later this morning to review the cases and update recommendations. Tomorrow is the day so many of us have been waiting for. Everyone 16 and older will now be eligible for the COVID-19 vaccine in Washington. Expanded eligibility will help us get people protected faster and help us slow the spread of disease. I'm thrilled so many people in Washington are eager to get vaccinated. I do have a favor to ask. Please be patient. Right now, roughly 5 million people are eligible, and starting tomorrow, close to another 1.5 million more people will be eligible. This means more people will be looking for open appointments. As I said earlier, our healthcare providers are doing fantastic work. They're vaccinating more than 57,000 people each day. We know they have the resources in place and the plans in place to vaccinate even more people than that, but it all continues to boil down to vaccine supply. And our state allocations have unfortunately gone down recently. Our latest vaccine forecast from the federal government shows we'll receive about 365 doses of vaccine over the next 3 weeks. This total includes Pfizer and Moderna vaccines. Our forecast did show 4,300 doses of J&J for the next couple of weeks. But the outcome of today's ACIP meeting will likely determine the timing of when this vaccine will be available. There is additional doses of vaccine also coming into the state through direct federal allocations, including pharmacies and community health centers. I want to close again by thanking our partners, providers, and the community for your continued hard work and patience. It's really thrilling to see us 4 months in to this vaccine effort, the largest vaccination effort of any of our lifetimes, and see that we've already given more than 4 million doses of vaccine out in our state, and we really are ready to expand eligibility to everybody age 16 and older. So tomorrow's an exciting day for Vax Day, and really looking forward to helping protect everyone in our community who's eligible by vaccination. Thank you.
Thank you, Assistant Secretary Roberts. Next, we'll go to Dr. Wando Anyoku.
Thank you so much for having me this morning, Department of Health. I'm so honored to be able to share with you the work that Swedish has done with our mobile vaccination clinics. This has been our effort to address equitable distribution of vaccine. And this initiative kind of speaks to two of the three legs in the stool that Dr. Shah talked about. It speaks to logistics and it speaks to demand and confidence in the vaccine. Early on, when we started delivering vaccines through multiple mobile sites, the strategies were mostly tech-based. So people were signing up online and had to come to these set centers. And those presented challenges for particularly low income and more vulnerable populations for whom technology or even mobility might be an issue. And so we started thinking about how we can target distribution to vaccine in those communities. We used data that identified hotspots where people had higher risk of contraction of the virus and more difficulty in getting access to it. And we also were very mindful from the beginning about vaccine hesitancy and people who might be hesitant about getting something that's so new. So we took a couple of steps. First, with the gifts from our philanthropic partners, Cellnetics Pathology and Labs, from T-Mobile, from Denali, and most recently from Starbucks. It allowed us to stand up a fully mobile unit where we could take a tent and all of our supplies to different locations. And then we're not subject to being indoors with the restrictions of social distancing and so forth. And some of these, and we also decided to work with community-based organizations for a variety of reasons, and I will go into them in a minute. But with respect to the fully mobile unit, those community-based organizations are quite different. They don't all have buildings. Some of them have a storefront, some have bigger, and some have parking lots, some don't. So being able to be fully mobile allowed us to mitigate all of those challenges. But most especially, partnering with community-based organizations gave us a trusted partner that allowed us to target outreach to the communities that we're trying to serve. And we could work through them to get information, get questions answered for people in those groups so that they could receive it in a space where they felt comfortable and safe. So they could be churches, or they could be community centers that were, developed through affiliations of either a country like the Ethiopian Health Center or language, or different things that people identified by. So we were very concerned about vaccine hesitancy very early on, and found rather quickly that a bigger piece of the pie, while hesitancy was real and continues to be, access was a really big problem. So, grandma and grandpa whose first language is not English and didn't have teenagers around to help them refresh, that was just never going to happen for them. So we set up these arrangements, and I'll give you an example. Our very first center that we started on January 26th, which was when we did our first community pop-up clinic, was in the Ethiopian Center in South Seattle in Rainier Avenue. And the language of that community is Amharic. And we tried to get signage and handouts in Amharic. And the CDC is very generous with a lot of languages, but Amharic was not one of them. So because we had that partnership with that community-based center, they were able to help us do translation and make literature available. They also set up webinars where we could provide information, answer questions for their population, and get people more comfortable, and got lots of people to sign up through that methodology. And when we partner with the community-based organization, our structure really has a small core of employees who do the work, but a lot of volunteers. And we were intentional about asking for some of those volunteers to come from the specific community. What that did was give them more ownership. But it also helped to provide people who could translate in language and, with people that the community was more familiar with. And so on the day of the clinic, we had all these people we gave them little vests that identified them as volunteers, and they were able to help, people through the process. We started this effort on January 26th, and to date, we've given over 4,000 doses of vaccine through this initiative. And those numbers are not huge, but they're targeted, right? So we get elderly people in a in a Latinx church in White Center. We've gone out to Asian Pacific Islanders in Federal Way, reaching out based on where the data suggests to us that people are at higher risk. And the work of being intentional about equitable distribution really relies on data. So after we'd done a first round of dose 1 and dose 2 clinics, we used Moderna for this effort. We looked at the data that we were, that showed what we were doing, as well as what the state was showing who was being served, and identified that there was major opportunity to close gaps in the Black and African American population, as well as the Latinx population. And so in our next wave, we were now intentional while looking also at the zip code, but looking for organizations that serve those populations where we identified opportunities to close gaps for them. And so we've continued to do this. Yesterday, we did one most recently yesterday with the Southeast Seattle Senior Center in Rainier Valley, so lots of seniors. And those experiences are so rewarding because people feel like you've honored them by bringing vaccine to them. You really care about what matters to them, and you're making things easier for them, which had been previously really difficult to surmount. And so as a clinician and one who's done this for many years, I'm a pediatrician, so vaccines are my jam. This really is a special experience for us because you can see how instantly you get the feedback. I would like to point out, to acknowledge, as Dr. Shah said, that there are multiple different organizations doing this kind of work at this point. And we try to connect across different healthcare systems and fire departments and just have awareness as to what each of us is doing. And so if we filled up in this place and are not able to serve some more people, we can refer them to other partners across our region so that people are getting served in this way. And it's really been I think one of the few bright linings of this pandemic is really the understanding of bringing the collective way of solving problems and bringing public health to the fore. So, I'm a public health head, so I'm speaking to my tribe here. So it's been a great way for us to serve our mission to improve the health and well-being of each person, not limited to our Swedish four walls, but going out into the community to make sure that we're serving people in the way that they need to be served. And I am happy to talk about, to answer as many questions as people have. We've partnered with YMCAs, with churches, with all sorts of different groups, and it's really been a really rewarding experience. And I thank you for giving me the opportunity to share that story.
Thank you, Dr. Onyoku. This brings us to the Q&A segment of today's briefing. We have several reporters in the queue with questions today. If we're not able to get to your question, please reach out to us at doh-pio@doh.wa.gov. Our first question today comes from Steve with Como. Go ahead, Steve.
Can you hear me now?
We can, go ahead.
There we go. Thanks again for taking the time to take questions again this week. Regarding the vaccine supplies from the feds, I'm curious with the announcement from Pfizer yesterday about ramping up production. I think the number was 10%. Do we have any idea what effect yet that will have on the state's supply over the next couple of weeks? I don't know if we have updated numbers from yesterday, since those usually come out on Tuesdays. And then also with vaccinations, about 20% of the state is vaccinated right now. That's been over a 4-month period. When do we expect to achieve herd immunity, and do we think that that's still attainable?
Thanks, Steve. Let me take a crack at the second one, but I will ask Dr. Lindquist to weigh in as well on the comment about, or the question about, the herd immunity. I think one thing to keep in mind is that it's taken us 4 months to get to about 20% of our state vaccinated. The largest barrier thus far has been vaccine supply. And so, we do believe, and we've already seen that our slope, our increase, if you will, for vaccines and vaccinations has really mirrored quite a bit about what the supply has been coming in. When the supply increases, we're able to vaccinate more. When the supply levels off or something happens, interrupted, then obviously the number of vaccines administered starts to level off as well. So it's really right now very much dependent on the supply piece. So we do think that as we continue to get more supply, that will allow us to get to that number, which I call adequate vaccine coverage. Folks refer to it some as herd immunity. It's a combination of those who have been infected by COVID-19 as well as those who've been vaccinated. And I think from our standpoint, the biggest challenge is that we just don't have as clear of an idea of what's happening on the supply side. It's gotten markedly better, the information, but I will tell you that even when you said, with Pfizer, the 10% kick up on their productivity production side, we don't know how quickly that translates to, or over what time period it translates to increased vaccines to us at the state of Washington. So there are just still a lot of unknowns when it comes to the vaccine supply and the constraints, but we are confident once we get past that and we start to get to those other two legs of the stool as being those are the real rate limiting steps, we're going to have a better idea of where we are with how long it's going to take to achieve a certain number. Scott, do you want to add to that? And then Michelle, you might want to go to the first question about supply as well.
Yeah, this concept of what percent of the community needs immunity to stop an outbreak from occurring is not unique to COVID. And there's a very specific formula for calculating this, and each disease is different. So like if we're talking about measles, you need over 90% of the population to have immunity either through infection or through vaccine. For COVID, the calculations are about 2/3 or higher. So anywhere from 70 to 80%, depends on what the model is predicting. So we're talking about how fast we can go from 20% to 70%. And as Dr. Shah just outlined, that really is dependent on vaccine availability. So the goal we're shooting for is at least 70% for COVID-19 to try and have some major effect on limiting this outbreak.
Great. And I'll just hop in and add, Steve, to your first part of the question, the numbers I shared earlier about 365,000 doses of vaccine for next week is the Tuesday update from CDC. There's potential for about another 4,000 doses of J&J vaccine on top of that, depending on what happens and what the federal decisions are about how long the pause will last. It is great news that there's some potential for increased supply from Pfizer or increased production, but that's not in our numbers yet, as Dr. Shah said. We'll see probably how long does that need to translate to when that increased production will turn into actual doses of vaccine being distributed.
All right, our next question comes from Ariel with the spokesman.
Great, thank you. I have two sort of separate questions. First, is the Department of Health working directly with providers who were beginning efforts or in the middle of efforts to use the Johnson & Johnson vaccine to vaccinate farm workers and agricultural workers? And then my second question is, at what point, if any point, would DOH step in and move counties back who were already sort of on the edge of being moved back to phase 2 on Monday? Thank you.
Great. As far as the question about mobile teams and outreach to including our farm worker community. So with the Johnson & Johnson announcement yesterday, we did reach out to all of our DOH mobile teams, including the teams that are supporting vaccination of agricultural workers to make sure there's an alternate type of vaccine available. We're also meet weekly with our local health partners, especially around vaccination of farm workers. So with the local health jurisdictions that have the majority of farm workers in the state, and we are letting them know about how they can request additional types of vaccine if or transfer vaccines if they did not have anything but J&J available. So yeah, that's a pretty active conversation to make sure anybody who had J&J only, that they have another alternate this week for vaccination going forward. Just as a reminder, J&J was a pretty small amount of the overall vaccine in our state, only about 6%. So a lot of providers, the J&J coming this week was only about 12,000 doses. So it's not the majority of vaccine in our state anyways. So it's pretty easy to make those adjustments.
Yeah, and a reminder, Ariel, that it's not just about the vaccine that we're communicating with the medical providers. It's about the clinical approach to if you are a person who received the J&J vaccine and you have these symptoms. CDC released a health alert network that we updated for ours to clinicians about what should you do if you come across one of these patients, how to approach it clinically, and to make sure that there's a vaccine adverse event report done. So that communication has been pretty strong. And then Lacey is our best person for talking about phases.
I can jump in on the second question and say, first of all, counties, local health jurisdictions have access to our Washington disease reporting system and are regularly receiving epidemiology reports from the Department of Health. We also walked through the methodology with our local health partners last week, and counties, do get notified ahead of public release of the report and phase status metrics. So hope that answers the question, Ariel.
All right. It looks like we've lost Dr. Shah. We will attempt to bring him back in. But in the meantime, our next question will come from Nicole with Cairo Radio.
Thank you for taking my question. My question is kind of piggybacking off of Ariel's a little bit, but kind of taking it a step further, I guess. I'm just really curious about the details of at what point would the state or potentially local health departments make the decision to send a county back in between those 3-week intervals. So, I mean, how bad would the case and hospitalization rates have to get to make that decision? Could you give me any firm numbers on that?
So I can start, and it looks like Dr. Shah is coming online. He and Scott are welcome to add to this. So we're looking at our data every day, all of these data, cases, hospitalizations, death, hospital capacity, to really understand the trajectory of where the disease, where it's going next, and our ability and our community's ability to manage it and control it and balance it with all of the other health risks and decision points we have to make. Local health officers and counties always have the authority to act in between phases, as does the state. We certainly want to do that in partnership with our local partners. But if we sense imminent danger, we will act. And there's clear evidence from earlier in the pandemic that the state will step in and roll things back, or turn the dial down if we need to, because disease rates are rising.
All right. Our next question comes from Jessamine with Q13.
Thank you very much. Appreciate all your time. Michelle, last week you had shown us a graph that showed a closing gap between what providers were asking for in allocation and where they were, what you were actually receiving. It showed to be closing at a pretty rapid rate, and Johnson & Johnson isn't a huge amount of the allocation. I'd like to know how you feel about the amount that you're receiving, and when do you think that gap might officially close?
Great question. It's kind of the $1 million question. I think the closing gap is partially influenced by the amount of vaccine we have. Providers were in the beginning more hopeful and ordering closer to what their full amount they could uses versus realizing what we really have available. So that's part of the gap closing. I don't really have a projection. I think the J&J manufacturing issues of a couple weeks ago and now the pause is a piece of what's happening with our vaccine supply. it was really great last week when we had actually about 100,000 doses more in the vaccine in the state allocation, around 460,000 doses. There was demand and places waiting for that, and additional places waiting for that. So I think we have a way to go to exhaust our vaccine capacity. Some early estimates had shown, or some work we had did with providers to understand capacity, had said that our provider community, the 1,500 providers that are registered or providers in our state, have capacity for up to around 150,000 doses of vaccine per day in our state. So we are a long ways from vaccinating at that level. And I think the more vaccine we can continue to get, providers are ready and have plans. And just like we heard our partner from Swedish, plans from within the four walls, and all these amazing community outreach efforts as well, to really focus our efforts on the needs of local communities. And the more vaccine we have, the more we can continue to do that.
Frangie, this is Umair Shah. I apologize. I lost power and Wi-Fi. Everything just went black and everything went off, and so I'm back just in time to kick it over to Dan Laster. Dan, I don't know if you wanted to answer anything related to that, because I know it's not just a supply and a demand issue, but also in terms of our partners and working towards stress testing the system. And I know you've been working on the personnel and what you're hearing from our private partners. I don't know if you wanted to add anything to Michelle's question.
Sure. First, I want to make sure people can hear me. Yeah, right. To date, although, you know, as especially tomorrow with almost another 1.5 million Washingtonians being eligible, you know, we at the end of the day don't know, but all indications are we are ready and we are prepared. I'm sure there are going to be places where we will have needs and we will fill them. But we've worked really hard across the state, working with the LHJs, working with our private sector partners to try to anticipate and build the capacity where we need it. So you know, given one can never truly know, I feel like we've done a very good job to try to have the readiness. I hope that helps answer the question.
Thanks, Dan.
All right, we've got about 4 questions left in the queue.
Frangie?
Yeah.
Dr. Onyoku wanted to make a comment.
Oh, I'm so sorry. Please go ahead.
No worries. I think with respect to the opening to more people being eligible tomorrow, it's important to note that even the large max sites, you know, we started the mobile clinics as an equity initiative, but the large sites have also built in some of that capacity. So they are working with community-based organizations, and they're also preserving, you know, trying to prioritize certain time slots to allow for communities who may need extra help or, you know, particular assistance. So I think there's been a lot of work that's been done by a lot of different organizations, and we're pretty confident that we can meet the challenge that tomorrow will bring.
Yeah, and one additional point, just from an equity lens, I know that we've been encouraging our providers, and in connection with our vaccine locator tool, to have more visibility to the accessibility of particular provider sites, so that Washingtonians, when they're planning, they can make sure the sites can accommodate their needs. The other thing I would just add is we're working this week with our vaccine locator tool to add vaccine type. Those of you who would have tried the tool initially, that wouldn't have been there, but particularly with adding those 16 and older, Pfizer being the one vaccine for those younger Washingtonians, we're adding that and encouraging that visibility from our providers as well to, again, make it easy for Washingtonians.
And with that, Frangie, we'll turn it back to you. I know you got 4 questions in the queue.
Thank you so much. I appreciate the comments too. All right. Our next question comes from Ryan with KIMA TV. Go ahead, Ryan.
Can you hear me okay?
We can. Go ahead.
In the DOH data, the new COVID case count and rate was based on the 14-day period of March 20th to April 2nd. The hospital metric was the 7-day period of March 24th to the 30th. It's kind of a three-part thing. One, what determined those specific dates to be used in rating the counties? Second, what sources were used by the DOH to get their data? And finally, did the counties have time to respond to these numbers to make sure everything was accurate?
Brian,
Sure.
thanks. Yeah, I'll kick it to Lacey. Go ahead, Lacey.
I can start and others can add. So in terms of the date ranges, we look at date ranges that are as recent as possible and complete as possible. And generally, we're trying to get 90% complete data or higher. And sometimes it does take a couple of days, a few days, or even a week for cases to come into our system. So those date ranges are the time at which the state has 90% typically of our hospitalization and case rate data. That's how those ranges were determined. In terms of the sources, there are three main sources of data that are coming in for the metrics used in the Healthy Washington Roadmap to Recovery. The first is the Washington Disease Reporting System, and that's our statewide surveillance system for collecting information on a whole host of notifiable conditions, not only COVID-19. So, it includes other conditions like measles, for example. There are a variety of providers that report those notifiable conditions into the system. So that's one source. The second is called the Rapid Health Information Network, and that is a syndromic surveillance system which collects near real-time data on patient demographics, their symptoms, chief complaints, and diagnoses from hospitals and clinics across the state. And then the third is called Washington's Healthcare and Emergency Logistics Tracking Hub, and that is a data collection system that receives data from hospitals on their census, occupancy, generally, and for ICUs. So those are the three sources of data that are informing those case rate or case count metrics, the hospitalization rate or hospitalization count metrics, as well as the ICU occupancy metric. And I had mentioned earlier, for a previous question, our local health jurisdictions have access to WDRS, the Washington Disease Reporting System. We are sending them a report daily about the epidemiology in Washington State, including their hospital admissions. And we went through the methodology with them last week and worked with many of them over the weekend on confirming numbers to make sure this was as accurate as possible.
All right, our next question comes from Essex with Cairo.
Yes, good morning, and thank you. Two questions. First, since one of the big reasons for the pause was to let clinicians know how to treat any blood clots that might come from those who have the J&J vaccine, might Washington State lift the pause once you are assured all the clinicians know what to do if they run across this? And second question goes to the comments about a perhaps fourth wave. Is there time, are there enough vaccines to stop a fourth wave before it grows larger?
Essex, thanks. I want to just to be clear, that was a main focus in terms of provider education and information from the federal government. They're also obviously they wanted to review these 6 serious outcomes or adverse effects, and they wanted to also make sure that they were looking at all the data across the country. So I think there are a couple things that are happening. If we feel, based on all the information, and I do want to, let me back up very quickly. Today, the CDC's ACIP committee is meeting, and the Western Governors Scientific Review Group is also meeting. We're going to have a tremendous amount more information after the federal partners, CDC and FDA, plus what's happening here more regionally. We'll have more information. So we're always looking at all of that together. And if there appears to be the ability to move more aggressively or assertively forward, we could do that. But right now, we want to make sure we're being as methodical and careful. There's still a few unknowns that we're hoping that today will answer those questions. And then also, I believe CDC, for example, has a call with healthcare providers scheduled for tomorrow. So we want to make sure that the process works itself out. Scott, I don't know if you want to answer the question related to the fourth wave and the vaccines. Obviously, this is the race against time. It's the million-dollar question of how quickly can we get vaccines in before we start to see, unfortunately, communities across the globe move in the wrong direction. And so this is something that we are concerned about, but we can't do anything more with supply than essentially you access it. We're not manufacturing the vaccine. We're not sending it to the state. All we can do is when we get it, receive it, administer it. And that's where we're focused on. But Scott, you may want to add something to that.
Yeah, Essex, I would just say it's not just about vaccine. It's about the behaviors people can do right now. And yes, we are seeing increased cases. There is big concern that's a fourth wave. People need to distance themselves. They need to wear a mask. I know the weather is turning nice. I know people are tired of doing this, but really measuring, do I really need to go on spring break to Mexico? Do I really need to travel unless it's essential? All these behaviors are things that we can do right now. The vaccine is clearly a great strategy, but the behaviors have turned all these waves around previously, and so it can be done with this one also.
All right, we have 2 questions left. Dr. Shah, would you like to continue or provide closing remarks?
We're bumping up against a couple of other things going on, but if we could do some quick 2 questions, we'll do our best to get them in.
All right, we've got a question from Hannah with Q13. Go ahead, Hannah.
Hello, can you hear me?
We can, go ahead.
Oh yeah, sorry about that. So is there a shortage? Can you confirm that there is a shortage at this point regarding vaccines for 16 and 17-year-olds, considering the halt with J&J and Pfizer being the only vaccine available for that group of kids? And if so, is there any conversations or plans maybe to hold some of the Pfizer specifically for those 16 and 17-year-olds?
Michelle, you want to take that?
Yeah, there is not a shortage. I would not call it as a shortage of vaccine. There is over 100,000 first doses of Pfizer in our state allocation, more coming in through the federal allocations. We have said opening it up to all will take time. It was never a magic vax day that everybody, all 6.3 to 6.5 million people 16 and older in our state would have vaccine on that day. It's movement in the direction. It's the beginning of getting our whole community protected. It helps making sure families can be vaccinated together if that's what would help them the best. So it's the start, and it will take time. So, and definitely always looking at alignment with where vaccine goes to what populations they serve. So that is part of the thinking and the ordering as vaccines are allocated. We don't have enough for all the providers in our state yet. And so it will just take time, which is why I really emphasize the need for patience. And again, once again, this J&J was a very small portion of our vaccine, less than 6%. So the J&J pause is not really impacting kind of the overall challenge of vaccine supply in our state at the moment.
And Frangie, we'll squeeze in the last question.
All right, our last question comes from Evan Bush with the Seattle Times.
Thanks for squeezing me in. Is DOH seeing data that suggests that an increase of hospitalizations among younger people in Washington could be due to the increasing proportion of variants?
Scott, do you want to answer that one?
Yeah, Evan, it's a great question. There is clearly a part of this that is answered by the variants. They tend to be more infectious, and the concern is that they're more serious, but it isn't as simple an answer as that. We are seeing the majority of our isolates are the variants of concern. So clearly B117 and 429 are driving the cases here in Washington, which are associated with higher hospitalizations, but it's not as simple as that. Again, it is, this is the group that is growing in the highest percentage because of behaviors, to be honest. Lots of people in this younger age group are at all the places where the outbreaks are: bars, restaurants, and travel. So that sheer number increasing in that age group is going to have with it an increase in the hospitalization numbers for those people. So part of that is just a sheer volume, and the other part of it is the prevalence of B117 and 429.
Yeah, and I just would add to this is just, again, we're at a difficult time, and the difficult time is because we're trying to vaccinate and trying to remind everybody that, you know, don't have COVID fatigue, do everything you can to help fight this pandemic. And we know, as Dr. Lindquist just mentioned, that it's nice outside and people want to go outside and not have, you know, take care of all those preventive precautions that they need to. We're still in this pandemic, and we're in it until we're no longer in and it's over. And we are going to have these twists and turns. And obviously the news from yesterday was one example of that. And it's not going to be a seamless process all the way through the end of this entirety of what we're doing to respond to the pandemic. So 4 months in of the vaccinations, we made tremendous amount of progress, 4+ million doses delivered and as administered. And as Michelle said, we've got, you know, so many people on a daily basis that we're vaccinating. As Dr. Onyoku is showing on the ground, we're not just talking about numbers, we're talking about equity and making sure that we're reaching out to people, not for them to come to us. And Dan is doing a fantastic job of bringing the private sector in to help. It's in all of us in this together. And so I do think that we worry, as both Scott and Lacey showed and described, the fact that we are at the end of the day having a situation where if we do not continue to remind ourselves of those preventive precautions and the importance of vaccinations, we will unfortunately see similar waves as are seen across the country, and we don't want that to happen. So it's up to all of us. And so I want to say thank you to all of you for joining us today. Sorry we went a couple minutes over. We wanted to squeeze those last couple of questions in. And with that, I want to thank our panelists, and I'll turn it back to you, Frangie.
Thank you, Dr. Shah. Well, this concludes today's media availability, and I'd like to echo the thanks to our panelists for their time today, and also TVW for hosting today's live stream and archives of past briefings. Thank you all, and take care.
Bye now.